the progress in the fight of AIDS is told even before COVID. And of course, with COVID, we actually sliding backwards. And the reason when we say sliding backwards is say that we are having less tests, less people with HIV infection starting treatment, and this makes more difficult to have an effective treatment and so prevent death, basically.
So why have people stopped being tested and then potentially going on for treatment?
Yeah, of course, this is where this happens, where the health system, let's say, are less resilient or less flexible. And of course, as MSF that operates in 90 countries, we see these more in countries that are low, middle income countries. And we have example both in Eastern Europe or also in South Central Asia region. And these affect more group of people that are vulnerable and are in neglected settings. But also we can think where there are new or ongoing conflicts, and like Myanmar that have a lot of health facilities that shut down even before COVID. And so there is no place where the people can get diagnosed, and this means cannot start treatment before the HIV develop in disease that is called AIDS. So what we see that also the major co-infection for HIV patient with HIV is TB and so tuberculosis. And so we see that there was an increase in mortality, and we are also step back with the success we had with TB back to 2017. So when we are talking HIV, we are talking also about other diseases that affect neglected population or settings.
That is interesting. So there's a sort of complexity with the infection. You know, when you talk of some of those areas, are there still stigmas surrounding the community messaging around HIV/AIDS?
Yeah, probably where in our setting, this is not felt as much, but in many settings, it's still a big stigma. The way to support this is actually involve the communities, and with knowledge we can fight this stigma. And one another point that was raised at the conference is exactly this: to involve the community and support with models of care that can detect early symptoms and diagnosis and start. Of course, this is possible with funding. And we know that with COVID, there was a shift in priorities, but AIDS is still a major cause of death in some places. And this is also a moment where international donors, there will be a new replenishment in September for Global Fund. That is one of the major organizations that tackle the issue of HIV, TB, and malaria. Because with funding gaps, there will be also difficult to implement new tools, because in the conference we see new treatment, not just for HIV infection, but also to prevent HIV infection. But of course, this required funding and to be able to implement where the needs are most.
Yeah, and that is such a good point, because you've got what's sort of commonly known now as PrEP, which actually prevents the infection, but also then the retrovirals once you have it. You know, is there consideration of how fair and equitable access to those drugs are?
Yeah, exactly. You mentioned the PrEP, and we have a new antiretroviral drug that is called cabotegravir that is a long-acting. It means you need one injection every 2 months after the first month. And of course, it would be, and it is also more effective than the other PrEP option we have. And at the moment, it seems that the cost is around $20,000 per person per year. And we can see that it's difficult that can be implemented at this cost in the setting where most are needed. There was also an interesting session in the conference about women that could definitely benefit from these. And there is study that say that the cost of cabotegravir long-acting could be reduced up to around $20 per patient per year. But of course, we need efforts from the producer, and there is some step in this because there is an agreement with Medicine Patent Pool that there are 3 companies that could produce the generic of this drug, but of course 3 is not enough, especially in country where there is the facility to produce generic. I'm thinking about Brazil, India. So I think it's good we have this tool, but the road is still a bit long to get there.